Let's get started. So it's all about inflammation. Everything is about inflammation. So as we have begun to investigate the origin of cardiovascular disease, we began to realize that inflammation was crucial. And as we looked at cardiovascular disease, we realized that inflammation was crucial in many diseases, if not all of the chronic diseases. So let's start. So what is inflammation and why do we care? Inflammation results from the activation of the immune system in response to a threat, bacteria, virus, parasite, or trauma. Inflammation has been recognized and actually described since the 1st century AD by the Roman physician Celsius. And he described it in terms that medical students today still describe it, using the Latin to describe the characteristics of inflammation: rubor, tumor, calor, and dolor, which mean redness, swelling, heat, and pain, and which everyone who's had any inflammation also knows that those are the characteristics. And we've all had inflammation. So when the inflammatory response started, it can be either appropriate and limited, which it usually is and should be, or it can become chronic. So this is the sequence of activation of the immune system. You have the initial injury followed by activation of the immune system. And the activation occurs in essentially two parts. There's the humoral component, which consists of antibodies produced against whatever the invading organism is. And you have the cellular and chemical response, in which the cells attack the invading organism, and the cells release chemicals designed to also destroy it. Two of these chemicals are recently in the news. One of the pyrogens, which are the chemicals that cause fever and help us fight infection. The other are cytokines, and the cytokines are important because of their role in some of the devastating effects of COVID, and we'll talk about that in a second. So you have the immune activation, you have the two components, and then hopefully you should go through into resolution. And the resolution is accomplished with the help of some specialized proteins that have just been recently described, called SPMs, or special pro-resolving mediators. If you don't proceed to normal resolution, the inflammatory response proceeds to chronic inflammation and to chronic disease. So the pattern is damage, inflammation, resolution, and repair, or chronic inflammation. So chronic inflammation has been implicated in numerous diseases: cardiovascular disease for sure, cancers, diabetes, dementia, autoimmune disorders, arthritis, inflammatory bowel disease, asthma, multiple sclerosis, and other neurodegenerative diseases, eczema, cystic fibrosis, and celiac. So the question is, if we have this essentially protective mechanism that's supposed to save us, and yet it proceeds on to serious consequences, which can seriously damage us, how did we get to this point? So if you go back to the evolution of mammals and early man, there were three major problems that needed to be solved. One was a mechanism for storing energy in the body, so it could be stored in times of plenty and drawn on in times of famine. You needed a very effective control mechanism to prevent and control infection. And you needed a blood clotting system, which would prevent us from bleeding to death with trauma, and more importantly, from bleeding to death in childbirth. So this slide here is for two reasons. Number one, it shows the point that food was not very plentiful and certainly not very varied. But it also shows another point, which I wanted to make, and that is that our caveman ancestors are always depicted as being these chubby little guys. But in reality, they were very muscular and they had probably not an ounce of fat on them. So what's happened is that our biology is evolving to solve these particular problems, but human society has actually evolved faster. As you can see here, evolution is slow, but society moves quickly. If you go back a ways, 60,000 years ago, we lived in a very rough neighborhood. A lot of trauma, a lot of infection, food scarcity. But as the time passed, mankind got smarter, and agriculture, 10,000 years ago, agriculture and animal husbandry began to develop. And this provided several important things. Number one, food suddenly became more predictable and plentiful. Animal husbandry not only contributed to the food supply, but also contributed to the workload. So as man evolved, they had more food and they had less work. But even by the 19th century, up to 90% of Americans still lived on farms, and they led a very active life physically, even if they had the help of the animals. But then fast forward to today, and we have more food, and we have more obesity, we have less trauma, less exercise, and less infection of the magnitude that we used to have. So getting back to the COVID was really a good example of what happens when our immune system is challenged in ways that it hasn't been before. You had an aggressive immune response with massive tissue destruction from a cytokine storm. You also had aggressive clotting response resulting in strokes, heart attacks, loss of limbs, loss of kidneys. So the immune system was hearkening back to the old days when it really had to fight for us, but it hasn't more recently until a challenge such as this. So let's go to the cardiovascular system and the immune and the effect of inflammation. So cardiovascular risk factors are what initiate the immune response. And you all know what those are: the hypertension, hyperlipidemia, cigarette smoking, obesity, lack of exercise, stress. All of those factors result in damage to the endothelial cell of the blood vessel. So this is what a blood vessel looks in cross-section. And you can see these cells that line the blood vessel. These are called endothelial cells. And we always thought that these cells were like the tile on the kitchen floor. If you look at it from the side, they look exactly like the tile on the kitchen floor, squares laid out. But in fact, these cells are very highly productive little cells that produce chemicals that they release into the bloodstream and to the blood vessel wall, which helps maintain the health of the blood vessel. So when you start to traumatize it, the endothelial cells not only can't perform their function, but they begin to create other problems. If you take the endothelial cells from all the blood vessels throughout the body, and as you know, there are miles of blood vessels, The endothelial cells constitute the largest secretory organ in the body. But going back to the cascade of the immune response, the endothelial cell gets damaged. The immune response, and sometimes the endothelial cell can get repaired. But the problem is that the stress of the cardiovascular risk factors is a never-ending stress on the endothelial cells. It just keeps on. It's all day, all night. And so the immune system can't really resolve it because the insult keeps going. So you end up with plaque formation, and sometimes the plaques can rupture, which causes an immediate clot in the blood vessel, which results in a heart attack, stroke, peripheral vascular blood vessel blockage, and loss of limbs. So how do you deal with this? Well, we know that the risk factors are continually stressing the endothelial cells, but there are ways that you can address that. So let's talk about how does diet impact inflammation. So in order to understand diet in this country in the last 50 years, you have to go back to the 1960s when there was a famous study that purported to show that fat was the cause of all vascular disease. That if you could get fat out of the diet, you would have no cardiovascular disease. The problem was that this study was produced by a very famous researcher. And as a result, because of his fame, the study was not critically evaluated, and it was accepted as dogma. And what that led to was a medical community adopted it, and the food industry adopted it and began to put sugar into everything. The problem with eliminating fat is that there are only three sources of energy. There's fat, there's protein, and there's carbohydrate. So if you take fat out of the diet, you're left with protein and carbohydrate. Protein is more expensive to produce and to distribute on a large basis. Sugar is much easier. And there's all sorts of studies in this country about how the sugar industry arose and became a major political force. But the sugar that became ubiquitous in society on all types of food, especially children's breakfast food, led to what we now have is an obesity epidemic. However, some sanity eventually began to creep into this. In the 1980s, there was a remarkable study done in Denmark and Greenland, which documented the fact that omega-3s caused reduction in inflammation and that this had a major impact on health. Now, this is a remarkable study because the populations of Denmark and Greenland were identical. They came from the same genetic stock and their genes were identical, but their lifestyles were very different. Denmark had allied itself with the Western Europe and their diet was consistent with Western Europe. Greenland, on the other hand, was isolated. They had a diet primarily of fish and animal protein from marine animals and marine animal fat. We're going to get back to that in a second. In 2010 was the first study that documented the health benefits of the Mediterranean diet. Now, the importance of this was not that the Mediterranean diet was healthy, because it is a very healthy diet in terms of high in nutrients, but that the health effect of the Mediterranean diet was due to its anti-inflammatory effect. So moving forward from 1993 to 2018, we came back to the role of fat, except this time it was not fat in the diet, but fat in the belly or elsewhere. And what it showed was that fat cells in the chronically obese people led to diabetes and other inflammatory diseases. And it identified obesity as a leading cause of chronic inflammation. We're going to see how that works in a second. So this is coming back to fat, but it's not fat in the diet. From between 2000 and 2021, there were multiple studies documenting the role of sugar in causing chronic inflammation. More recently, there has been a lot of research into the microbiome, which is the colony of bacteria in our gut. And we're just beginning to understand how important this is, because what we're learning is that certain foods, as they enter the gut and they interact with the bacteria, will produce chemicals that are anti-inflammatory, which will help the whole process of inflammation. On the other hand, other foods entering the gut, the bacteria will produce pro-inflammatory chemicals, which increase inflammation. Now, the problem is that this is quite complex because what this depends on is not only what you eat, but what kind of bacteria you particularly have in your gut. So this is a work in progress, and how we're going to learn to eat and deal with this has yet to be determined. In 2019 was a key finding with the role of SPMs, which we talked about earlier, special pro-resolving mediators, and omega-3. So this is just to give you a quick look at the Greenland study. It's a complex slide, and I don't want to dwell on it, but if you look here, the amount of cholesterol in the Greenland diet was very high. The omega-3, however, the polyunsaturated is omega-3, was 4 times as high in the Greenland diet, and the actual grams was 5 times as high in the Greenland diet as in the Dane diet. And look what they found when they did public health studies of disease. Now, this was in the 80s, so I'm sure that things will have changed by now, because I'm sure the societies have changed and research techniques have changed, but it was still quite remarkable at the time. Heart attack was 5 times more prevalent among the Danes. Stroke, however, was higher among the Greenlanders, and we still don't quite understand that. But all of this is also true about the American Eskimo in the 80s. Since then, the Eskimos have started smoking and started having other kinds of things which impact us. Psoriasis, 5 times as much, the Danes. Diabetes, none. Asthma, none. Inflammatory thyroid disease, 5 times as much. Multiple sclerosis, none. Epilepsy, the same. Rheumatoid arthritis, 5 times. Ulcers, much reduced. Cancer, much reduced. Breast cancer, none. Inflammatory bowel disease, none. So how do the omega-3, yeah. Well, the fact that they're the same identical genetic population, it sort of takes the genetics out of it. It doesn't take other aspects of the environment. And that's why I say this may have changed since the 80s. So the question is now, how does omega-3, the essential fatty acids, affect inflammation? I think it's probably confusing for everybody, because I'm talking about fat and I'm talking about fatty acids and how do they relate. So I just want to make a quick point that fatty acids are a special type of chemical which bonds together to form fat. So they're really the building blocks of fat, as they are here the building blocks of SPMs. And that's the key to omega-3, is that they are the primary component of the special flow resolving mediator. Now, this is a complex slide, but I want to reduce it to its simplest form. So the point of this is to show how SPMs affect inflammation, which in turn affects disease. So let's walk through that. These are the foodstuffs from which the EPAs, the omega-3s are derived. Arachidonic acid is not an omega-3, it's another type of a fatty acid, but it still is involved with producing the SPMs. So you've heard of EPA and DHA. If anybody takes fish oil, those are the key components of the fish oil. So fish, algae, cod liver oil result in the production of the omega-3 fatty acids. They in turn, in this column, produce the SPMs, the specific SPMs. So the lipoxins are one type of SPM, and you can see here the diseases that it has been shown to affect and to reduce inflammation. Asthma, colitis, corneal disorders, cystic fibrosis, eczema, neuroinflammation, periodontitis. The E series resolvins, atherosclerosis, colitis, obesity, oral inflammation, pain, psoriasis, allergic reactions, and retinopathy. Protectins, Alzheimer's, asthma, ischemic stroke, neurodegenerative disease. D series resolvins, all of these, and marasins, pain, spinal cord injury, and wound healing. So without omega-3s, you don't get the SPMs, and without the SPMs, you don't get resolution of chronic inflammation.
Hey, Scott, this is Steve. Before you leave that slide, I didn't understand, what's the role of aspirin in this?
Okay, I'm glad you brought that up. I skipped over that. Thank you, Steve. I need an assistant for this. So aspirin has been uniformly recognized as a good anti-inflammatory drug. But the thought about aspirin was that it prevented inflammation early on instead of helping it to resolve. And what this study has shown is that aspirin actually triggers the production of the distinct SPMs. So aspirin helps resolve inflammation via these molecules. Does that help, Steve?
Yes, so it's an accelerant of the positive effect?
Correct, right. And that's why aspirin has a beneficial effect in cardiovascular disease, because it helps resolve inflammation. So the conclusion about the diet studies is that it's all about inflammation. The question of free sugars is complex. And I want to explain that because it's very important, not only to this discussion, but also to people and trying to manage their diet and trying to manage particularly weight loss. So glycemic index is a number that's assigned to foods that have carbohydrates in them that says whether this particular food causes a rapid spike in your blood sugar or it causes a slower spike. What that is basically means is that a free sugar, such as a donut, is very easy to metabolize and goes into your bloodstream. It goes up right away. A strawberry, on the other hand, has sugar in it, but it's metabolized differently, and its glycemic index is much lower, so the blood sugar goes up much slower. So what happens when you consume your 3 donuts for breakfast is your blood pressure goes up like a rocket. I mean, not your blood pressure, your blood sugar goes up like a rocket. In addition, as part of that, your insulin goes up like a rocket. The purpose of insulin is to take sugar from the bloodstream and take it across the cell wall into the cell where it can be used as energy or where it can be stored as fat. So the sugar goes up, the insulin goes up, and then what happens? Well, they both drop like a rock. Boom. And when they drop like a rock, what happens is you have a craving for sugar. So if you want to do an interesting experiment, get your 3 donuts and have them for breakfast, and then see when you get hungry. The next day, don't have anything to eat except water or black coffee, but nothing that has any kind of carbohydrate in it, and see when you get hungry. And it's remarkable. You'll see right away what happens. And so this is part of the problem with people who don't know how to eat, who have problems with obesity, because they have this spike and crash of their blood sugar and their insulin. If you're going to control that, you can do a lot with your weight. Okay, so next is omega-3. We've already talked about that. We know why that's important. You want to avoid obesity. Now, lean weight studies in animals have shown for years that if you take an animal, and this has been done both with a number of rat models and also with monkeys, if you take an animal and you maintain them at below their lean body mass, they live 30% longer. So you want to avoid obesity for all of these reasons. And this is another reason. So this is a fat cell that has been stuffed with fat. Cell typically would look like this. And then as you start to increase the fat, it grows and grows and grows. Now, and this is what is the source of the chronic inflammation from obesity. The fat cell gets stuffed to a point where it ruptures and it spills the fat into the fat tissue. And this material has been described as not dissimilar to diesel fuel. So it's distributed. I mean, it's a good source of energy. I mean, that's the purpose of it. It's supposed to be high energy. So it's spilled into the tissue, the fatty tissue, and causes inflammation, which causes diffuse inflammation. So you can see how that might happen. So the microbiome, we talked about, it's very complex. And the only thing that we really know for sure that helps the microbiome is a high fiber diet. So that's not complicated. You can help the microbiome by using high fiber diet. Curcumin is not specifically here because that's a major factor, but it's an example of a spice that is anti-inflammatory, and there are others. Fish versus beef. Now, this discussion is a very interesting one because beef has gotten a bad rap, and rightly so, but because beef that is fed in a feedlot eat a lot of things that are not natural. And because they eat unnatural things, they have GI problems. And because they have GI problems, they need antibiotics. And so it's a vicious cycle. So the fat of feedlot-fed beef is pro-inflammatory, and that's the major issue. On the other hand, there are examples where beef where their fat is neutral, it's either pro-inflammatory or non-inflammatory. That is English cattle, the Herefords and the Angus, that are fed on grass. Their fat is neutral. Wild game, on the other hand, their fat is anti-inflammatory. And there is another type of cattle called the Corriente. And the Corriente are all over Arizona because we use them in rodeo. And the reason we use them in rodeo is because they're fast, they're athletic, they're very lean, and they're much more similar to wild animals. Their genetics are very old. They come from way back in Spain. So if you eat Corriente beef that is grass-fed, you've got anti-inflammatory beef. Now, where can you get Corriente beef? Well, in fact, I have convinced several of the ranchers near me to start raising Corriente beef for food. And they're selling it like crazy in places like Aspen, because there are people who are very health conscious and want to be on the leading edge. And so you can find it if you want to find it. Oh, fish. Fish is interesting. But you wonder, why is it that fish are endowed with this wonderful omega-3 and our poor cattle have got this awful fat? And if you pull your sirloin steak out of the refrigerator and you look at it, the fat of your beef steak is solid at room temperature. It's big, thick piece of fat. Whereas your olive oil sitting right next to it is liquid at room temperature. Now think what would happen if the poor fish had fat that congealed at the cold temperatures that they live in. So that's why they have omega-3s, because they wouldn't survive if they had the other type. Maybe they did have it originally and they didn't come out of the swamp or went to land. The Mediterranean diet has been shown to be anti-inflammatory and it's nutrient rich, and it is the only diet that has been shown to reduce cardiovascular events. Now, there are a host of other anti-inflammatory diets out there because inflammation is now the buzzword. Everybody's talking about inflammation. And there's all sorts of anti-inflammatory diets, and some of them may be good. They need to be sort of viewed over time to see which ones are really valid. But they're out there. So now what about exercise? Well, the role of exercise, we hope, the purpose is to intervene in that cascade cycle of the immune response, both early on and to help with resolution, right? That's what our goal is with this whole inflammatory response. So exercise reduces the CV risk factors that we all know about. It's universally recognized as important to good health. But how does it relate to inflammation? So exercise has always been recognized as a good thing. Everybody knows it's helped, makes you feel better. But it was institutionalized in 776 BC with the original Olympic Games. But it wasn't until 2007 when there was an explanation for how does exercise really healthy. And that study, which was a study of 20,000 people, demonstrated that the major benefit of exercise was to reduce inflammation. In 2012, a very significant event occurred. Irisin was discovered. And irisin is now being studied. It's not publicly, it's not out in the public, but if you look it up on the Google, Dr. Google will tell you a lot about irisin. It's a fascinating molecule. It is named for the Greek goddess Iris, who Steve Wheeler will remember from his Greek mythology was the messenger to the gods. And this is released with exercise. And the reason it's named for Iris is because once it's released, it goes throughout the body as a major anti-inflammatory molecule, major anti-inflammatory protein. And people are trying to synthesize it and commercialize it because it is so anti-inflammatory. So it's released from muscle during exercise. It has extensive anti-inflammatory effects, especially in the brain. And I'm sorry, Eric isn't here to tell us more about that. Their highest levels occur with HIIT training. Now, HIIT training, high intensity intervals, is exercise where you do maximal intensity bursts of exercise with a rest, maximal intensity rest, so on. And that has been shown to be the way to get the maximum release of irisin. So most of us who have been plodding along on our treadmill doing the same thing for years, should start doing a little more of this interval training and HIIT training. It stimulates fat burning, stimulates bone health, and it has a whole other list of things that it does beneficially for the body, which I won't go into. So exercise also reduces risk factors, all of which cause inflammation. So here's the cascade again. Exercise has an interesting role in this particular cascade, though, because everybody knows that if you work out hard, you hurt for the next couple of days. And what you've done is you've damaged muscle. When you want to build weight, you damage muscle in order to build it. So you're creating inflammation when you exercise, but you're also, through irisin and other mechanisms, you're also creating the resolution for the exercise. So that's why it stops in 1 day or 2 days, and it's gone. And doesn't proceed to chronic inflammation unless there is something else wrong. So the conclusions from exercise are that it's anti-inflammatory for many reasons. Irisin is going to be an increasingly important substance recognized going forward. Exercise controls risk factors, and effects beyond inflammation are that it improves cardiovascular endurance, strength, stamina, joint health, bone density, and mood through endorphins. So the summary is that inflammation is essential and should not be inhibited, but naturally resolved through the SBMs. Evolution has put us in a bind. Previously protective biology leads to chronic inflammation in modern society. Chronic inflammation is at the root of many diseases, but can be prevented. Diet and exercise are critical and effective tools against chronic inflammation. And we can protect ourselves individually, and at a place like the Flynn, hopefully with education, we can also protect society. But there are always people who don't want to exercise, who love their Cinnabons, and will not be persuaded. I don't want to leave them out of the picture because they are very important too. So for them, we have a very quick, simple solution called the triple bypass. But sometimes it doesn't work no matter what you do. Well, something's just not right. Our air is clean, our water's pure, we all get plenty of exercise, everything we eat is organic and free range, and yet nobody lives past 30. So, thanks very much. So I'd be happy to take any questions if anyone has them. Yes.
So is weightlifting included in the HIIT training workout, or like is it mostly cardio that's preferred or better?
Yeah, it's included. This is what weightlifters don't like to hear. It's that if you just do straightforward weightlifting, you won't get you have a base level of iris. And when you do weightlifting, you don't get the spikes that you do with HIIT, but you can work a HIIT regimen into your weightlift to high intensity intervals, part of the program.
Gotcha. Thank you.
But you won't get the spikes, even with heavy weights. You won't get the spikes that you do with a interval.
Gotcha.
Scott, it's Rose. I'm on the screen. My husband will kill me, but so I just bought him a jacuzzi. So did I make a mistake?
I'm sorry, I couldn't hear that.
I said I just bought Harry a jacuzzi because after he works out, he has aches. did I make a mistake buying him a hot tub?
Absolutely, yeah. Just as long as it's grass-fed.
A jacuzzi tub. A hot tub, Scott, a hot tub.
The hot tub doesn't raise your irisin.
All right. It's okay then?
No.
No? Okay. Yeah.
I want to follow up question. I wear a smartwatch, Apple Watch, that monitors heart rate. And I noticed when I was just in Canada and went out to jump in the hot tub after a nice day, that my heart rate, I got an alert, like it is getting, yeah. You appear to be sedentary, but your heart rate is over 120 beats per minute.
So there was an after working out?
No. Yeah.
What time of day?
I think we went in pretty early, so.
Well, the reason that your heart rate would go up, you're talking about how high was Rose's? How high was Harry's heart rate?
I don't think his heart rate was high. I think she just bought him a gift.
So the answer is there are several ways that this could happen. Most likely because you went into it relatively dehydrated, and the blood vessels and the hot water caused the blood vessels to dilate, which drops your blood pressure, and your pulse rises to compensate for the lower blood pressure. Now, there also is a possibility that the hot water slipped you into an abnormal rhythm, but you would feel bad. You would not just see it on your watch.
Scott, this is
Yep.
Steve. Can you hear me?
Yep.
So two quick questions. First of all, do artificial sweeteners have the same inflammatory effect as natural sugars? That's the first one. And the second one is, if you had to pick between diet and exercise, you know, which will give you the most benefit? In other words, can you overcome the eating unhealthily simply by having a good exercise regime, and vice versa? If you don't exercise, can you overcome that failure by eating well? I know you're going to say you're supposed to do both, but if you were only going to.
No, actually, I mean, that's actually a choice that a lot of people sort of decide to make. And I would say that most people are not going to exercise the way they could to get the high peak of irisin and the anti-inflammatory effect. A regular exercise is helpful, but it doesn't have the major effect that it has with irisin. But most likely, a healthy diet combined with a small amount of exercise is probably the best way to go if you don't want to do both.
Okay.
A
And then how
healthy
about,
diet. What's that?
and then how about the artificial sweeteners?
You know, I don't know the answer to that, Steve. I'm sorry. Anybody else know about that? Mary, do you know about that? We can find out, though. I'll find out for you.
Well, don't tell me if it's the wrong answer.
Right. If you don't hear from me, watch out. Anybody else? Yes.
On one of your earlier slides, you were mentioning like the evolutionary changes in society and how that affected health and cardiovascular health and things like that. And trauma was one mentioned. What was considered trauma? Was it like physical trauma to the body, or just what was happening like in the environment? And like, how was that measured, and what do we consider trauma now?
So let's see if I have that. Type of trauma that are we evolved to protect against, is that apply to trauma like
Right, like you said, reduced trauma, like you said, reduced trauma in the slide. So what was considered trauma back then that is now reduced?
Well, you know, being ripped apart by a tiger.
Gotcha.
I was wondering.
Anybody else? Well, thanks very much.
Thank you.